Assalamualaikum warahmatullahi wabarakatuh. Good day for everyone. I want to introduce myself. My name is Hema Dewi. I'm from Universitas 11 Maret, Surakarta, Indonesia. And I want to present my presentation, my research with the title Overview of Balanced Nutrition Practice in Premarital Women of Childbearing Age in Semarang, Indonesia. So the introduction means that the non-communicable disease such as hypertension and diabetes mellitus still being the problem in the world, especially in Indonesia. For the prevalence in 2023, the prevalence of hypertension was 29.2%. And then the diabetes mellitus, the percentage 1.7%. And then in Central Java, in the same year, in 2023, the prevalence was higher than the mean in Indonesia prevalence, which the hypertension in Central Java is 31.3%. And then in the prevalence of diabetes mellitus in Central Java also higher than Indonesia prevalence, which the prevalence was 1.8%. And in Semarang itself, that Semarang was a central city of Central Java, in 2021 had the highest in the Central Java for hypertension and diabetes mellitus, which the prevalence reached 26.83% in Semarang for hypertension, and then the diabetes mellitus in 2021 reached 6.34% in diabetes mellitus. And the fact for all of the patient of hypertension and diabetes mellitus mostly affected in women. And I want to explain why we focus on premarital women of childbearing age. Because it is fetal condition, because relate to the conditions when the woman was pregnant, and it's related to the health of the baby they give birth to. If the woman of childbearing age with the risk for non-communicable disease such as hypertension or diabetes mellitus, it will be a problem in the future condition if they pregnant or in after pregnant, and it will be risk for the baby they give birth to. So the increased risk of cardiovascular disease such as stroke, heart attack, and coronary artery disease will be got to the woman with the risk factor, most risk factor like non-communicable disease. And for prevent the non-communicable disease like hypertension or diabetes mellitus or etc., we have to going to a healthy life with application or implement with balanced nutrition behavior, which the balanced nutrition behavior from Permenkes number 41 years 2018 consists of 4 pillars. The first pillars was dietary behavior, and the second, physical activity, the third, clean and healthy living, and the fourth, ideal weight monitoring. And so the research aims to know how about the application of balanced nutritional behavior based on the 4 pillars of balanced nutrition in premarital women of childbearing age in Semarang. The research was cross-sectional study, and the location include 9 sub-districts in Semarang City. And the respondent were 190 premarital women in Semarang with the age in 18 until 35. For the exclusion were pregnant, breastfeeding, had a chronic illness and specific dietary pattern. And we have the instrument that use a questionnaire to assess the 4 pillars of balanced nutrition, including dietary behavior, physical activity, clean and healthy living, and ideal weight monitoring that compiled in accordance with Premenkes number 41 of 2014 concerning balanced nutrition guidelines, which had previously been tested for validity and reliability. And for the result, the average age of respondent was 23.47, with the standard deviation was 3.83. And the majority of respondents live with their parents, with the percentage 85.86%, and they were majority vote in 61.78%, which the monthly income of average 2,114,500, with the standard deviation 1,596,4030 rupiah. And majority available get available in access of transportation, and which the nutritional status in the uh, underweight in 23.60%, and the normal 40%, overweight 12.63%, and the obesity 24.21%. This is the high prevalence of malnutrition like obesity, overweight, and underweight. And the sufficient category of balanced nutrition knowledge in majority of respondent in percentage 58.96%, 95%, and they have supported attitude in balanced nutrition in the percentage 60.53%, and had sufficient category of dietary behavior, which the percentage 59.47%. The physical activity not following guidelines, with the percentage 73.68%. And the appropriate, they had clean and healthy living in the percentage 87.37%. And they usually majority get monitoring ideal weight in 51.05%. And there is the result of dietary behavior, the percentage of good dietary behavior carried out in the behavior such as eat 3 times a day, and then breakfast habits, drink 8 glass or 2 liters of water a day, consumption of sweet foods or drinks, and then consumption of ready to eat or preserved food. And percentage of sufficient dietary behavior is carried out in for behavioral, such as consume food with complete nutrition composition, and then consume variety of side dishes, consumption of vegetable protein side dishes, consumption of animal protein side dishes. And also the percentage of fewer dietary behavior carried out in 3 indicator, such as read food composition labels, consume variety of fruit, consume variety of vegetables. And then the result for physical activity, uh, majority of respondents do not doing muscle strengthening at least 2 times a week. Um, and also that the physical activity in intensity not more than 600 in 40%. And then this is the result for clean and healthy living behavior. The majority of respondents doing well in clean and healthy living, but if we see in the graphic, the behavior that uh, still will be being problem is the in the oral hygiene. The respondent is still uh, not doing the brush teeth before sleeping, brush teeth after eating, and change the toothbrush every 3 months or maximal every 3 months. So we have to uh, do more in oral hygiene. And then this is the result for ideal weight monitoring. The majority of respondents doing well in the behavior of monitoring the ideal weight. So the discussion, the parent's nutritional behavior in premarital women of childbearing age is the key to preventing maternal disease in the future. This problem is relevant to the result of other similar studies and also pose risk of non-communicable disease or other conditions in the future. The results of this study were also in line with the results of the risk test and other studies relate to eating behavior, especially in terms of the habit of eating fruits and vegetables, which still like in the behavior of eating fruits and vegetables, and then consumption of sweet or fast food. That's still a phenomenon found in society. However, even though knowledge and understanding were still lacking, the majority of respondents still have an attitude that supports healthy living. Knowledge without being supported by a positive attitude will not produce the expected behavior. So the result of the study indicate that there was still a great need for promotional efforts to improve balanced nutritional behavior for premarital in childbearing age. If women are exposed early on, especially at a more mature age or young adulthood, it is hoped that it will open their minds to behave healthier for the future of themselves and their descendants. And there's the reference. Thank you very much for the attention.